Long story short, I had a very long labor, 26 hours long, with premature rupture of membranes at term and prolonged pushing phase, allegedly 5 hours, and was pushed to have a C-section because my baby wasn't descending because she was OP, allegedly. I think she was more ROP, if anything, because I felt mostly pain in my right pelvis and hip area. And then they pushed me to have a C-section. I consented to a C-section because they kept making me fear for my baby's life, saying, you know, it's been too long, and there have been a few variable D cells, which I believe was just my baby falling off the monitor, and my request for an internal monitor was not met. They denied wanting to do that for me. So I think I was just pushing her off the monitor, and then her heart rate was fine. She was moving the whole time like normal, and her heart rate variability was the same throughout the entire labor. And these few variable D cells they're saying I had, there was only a few of them, and she immediately came right back to her baseline. So I don't really think she was actually having variable D cells. I think she was being pushed off the monitor during contraction. Further evidence I have of that is the nurse was repositioning my monitors all the time and pushing really hard into my belly with each contraction, which caused a lot of pain because it was radiating into my bones because the baby was stuck. Anyway, I had a C-section, and the doctor ended up, I guess, inadvertently severing my right uterine artery, and didn't realize it and closed me up. And then in recovery, I started feeling really woozy. I started having giant black spots in my vision because I was going blind. Even my hearing was affected. I was vomiting. Eventually I started having chest pain and shortness of breath. The doctor refused to give me a mass transfusion, even though my blood pressure initially was 70/40 with a heart rate of 140s to 160s. And she said she wanted to wait until labs. And it didn't matter that I was a trauma nurse because this isn't trauma, sweetheart. This is labor and delivery. So apparently if you just deliver a baby, it doesn't matter how much you bleed because you're a woman and you're supposed to bleed. So she didn't want to give me blood. Waited forever for somebody to draw my labs because they couldn't get a stick because my veins were collapsing because I was hemorrhaging to death. The bed was literally filling up with blood. They kept lying to my husband that I was being traumatic. And when they finally did get my blood and send it to lab, it showed that my hemoglobin dropped from 13 point something to 6 point something in a very short period of time.